my recent medical episode, hospital evaluation, and daily prevention strategy. Number 1341, August 31, 2025. Gerald C. Shu, EclaireMD Foundation. Category: Special Information. The event. On August 30, 2025, I experienced one of the most alarming episodes in my stroke recovery journey. Since my hemorrhagic stroke on June 21, 2025, I want to record this medical incident in detail, both as a personal reflection and as a structured reminder to myself of the importance of strict lifestyle discipline in preventing future medical complications. Yesterday began as an ordinary day, but by noon I suddenly felt overwhelming fatigue and exhaustion, to the point that I could barely walk. I also experienced mild faintness, dizziness, and lightheadedness. My legs felt unusually weak, and my body lacked energy. Although my blood pressure remained within normal ranges, my heart rate had dropped to only 44 beats per minute, well below my usual resting average of about 64 beats per minute over the past 2 months. I became deeply concerned, not only because of the low heart rate, but also because of my medical history. Having suffered a hemorrhagic stroke on June 21, 2025, just a little over 60 days ago, I could not help but worry about the possibility of another stroke, or a seizure episode. The symptoms felt unfamiliar to me. This was not the usual post-stroke fatigue or mild dizziness that I had occasionally experienced since my first episode. My condition seemed acute enough that I feared a sudden deterioration. I must admit that I am still new and inexperienced in understanding the brain and the field of neurology, since my past research has focused primarily on endocrinology and other internal organs. Recognizing the potential seriousness of my condition, an ambulance was called by my Japanese friend, who had traveled from Tokyo to visit me after learning of my recent stroke. Observing my weakened state, he promptly dialed 911. Within 5 minutes, the Palo Alto paramedics arrived and transported me to the emergency department at Stanford Hospital. Contributing factors. Looking back, I can identify several unusual circumstances that likely combined to create this crisis. Medication. I had not taken any medication, including vitamins, for the past 15 years. However, since my stroke, I have begun taking 5 morning medications for diabetes, hypertension, dyslipidemia, thyroid, and seizure prevention. Yesterday morning, as usual, I took them, but only with a sip of water and no food. Normally, I take them with breakfast and a full glass of water. Hydration lapse. By noon I had consumed only 200 cc of water, far below my usual 1200 cc by that time of day. In fact, my normal daily fluid intake is from 2500 to 3000 cc. Social stress. Yesterday, I left home for my first social outing since the stroke. Meeting good friends from Tokyo was emotionally uplifting, but it was also physically and psychologically taxing. This combination, skipping breakfast, dehydration, medication without food, and added some degree of social stress, created the perfect storm for this particular event. Hospital evaluation. At the hospital, I was evaluated, under the diagnosis of pre-syncope, near fainting. Lab tests completed. CBC with differential. Magnesium, serum/plasma. Comprehensive metabolic panel. NT-proBNP, for cardiac stress. Phosphorus, serum/plasma. Rapid influenza A or B, RSV, and COVID-19 panel. Troponin I, high sensitivity, check twice, for cardiac enzyme changes. Urinalysis with culture if positive for infection. I-stat venous blood gases and lactate, performed twice. Lab tests in progress. Levetiracetam, anti-seizure drug, level, to confirm appropriate dosing. Imaging tests. CT head without contrast. ECG 12 lead. Medications given. Lactated ringers, LR, 4 bolus for hydration. Stopped at 7:16 p.m. Physical status. Weight measured at 163 pounds. Above results were reassuring. No infection was found. Kidney function was normal. Cardiac enzymes and metabolic markers showed no acute damage. My old brain hemorrhage was shrinking, with no sign of a new stroke. My ECG showed bradycardia but no major arrhythmia. A neurologist and 3 other doctors reviewed my case together. Their conclusion: this was not a stroke or seizure. The fact that I remained conscious and remembered every detail ruled those out. Diagnosis. The final medical assessment, pre-syncope from bradycardia, most likely caused by dehydration, fasting, and improper medication intake. Comparison with vasovagal syncope. Some might compare my event to vasovagal syncope, a condition in which sudden overstimulation of the vagus nerve causes the heart rate and blood pressure to drop, often leading to fainting. Common triggers include dehydration, emotional stress, and prolonged standing. I experienced 2 vasovagal episodes in Austin, Texas, in May 2024. My episode did share overlapping triggers, such as dehydration and fasting. However, key differences stand out. I did not faint, I did not lose memory, and I recovered with hydration and observation. These differences confirm that my event was not a classic vasovagal faint but rather bradycardia, induced by dehydration and fasting. Lessons learned. This experience reinforced several critical lessons. Always take medications with both food and a full glass of water. Maintain daily hydration of from 2,500 to 3,000 cc, distributed evenly throughout the day. Monitor heart rate and blood pressure consistently. Since my stroke, I have been checking my blood pressure 20 to 30 times daily to ensure close tracking and analyzing each hyperreon data, above 130 mm of mercury and 140 mm of mercury. Reintroduce social and emotional activities, gradually, allowing the body to adjust to both physical and psychological demands. Maintain regular exercise. I have increased my daily walking from 2,000 steps prior to my stroke to approximately 10,000 steps per day. Prevention is not optional, discipline is the foundation of survival. My daily prevention checklist. Hydration, from 2,500 to 3,000 cc per day, spread across the day. Nutrition and medication, never skip breakfast, always combine with meds. Monitoring, check and record HR and BP at least twice daily, but actually, around 20 times daily. Activity and rest, walk 10,000 steps when possible, rest when tired. Social balance, resume outing slowly, balance joy with energy limits. Safety, avoid dehydration and seek immediate emergency care if stroke-like symptoms occur. Use a cane while walking to reduce the risk of falling. Conclusion. The August 30th episode was a serious reminder of how fragile recovery can be. Luckily, it was not another stroke or seizure, but it was a preventable crisis triggered by dehydration, fasting, and medication mismanagement. Thanks to my good friend, who called 911, and to the excellent Stanford Hospital emergency team, who conducted a comprehensive series of tests, I learned that my prior hemorrhagic stroke scar is healing and that no new damage has occurred, my greatest concern during the episode. My path forward now depends on strict daily discipline, maintaining hydration, proper nutrition, consistent monitoring, and a careful balance between activity and rest. Prevention remains my lifeline, and I will honor it with renewed determination. Disclaimer: this content is for educational reference only and not medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be edited or republished as your own.